I'm with Lee.
Hello.
And Lee is one of the therapists here at Surrey Massage Clinic. I'm just going to ask a few questions about Lee. First one being, how long have you been working here?
I think it's between 17 months and 2 years. I can't quite remember. About that
during the lockdown.
During the
wasn't
lockdown,
it? Yeah. When everybody else was panicking, we were just like, yep, bring it on.
Let's do it. Get on with it.
And it's been pretty busy ever since.
Full on.
Yeah. Okay, Lisa, give us a bit of a brief description about what you do and what massage means to you.
Okay. Well, my fancy title is Advanced Sport and Clinical Massage Therapist. I've got a number of qualifications. I can't remember all of them, but I
serial course.
Yeah, serial. Yeah, lots of courses. What does massage mean to me? I love massage. It saved me from having a complete breakdown of my own years ago, complete career change, and I absolutely love it. I love the people I work with. I love the clinic. I love the clients, mostly, and it's a great job. It's a great profession to be in.
So would you say that massage is the right term for what you do? Because a lot of people think it's either a luxury or it's something a bit on the wrong side of the track, so to speak.
Well, in this country, it's kind of seen as something you do as a treat or a luxury.
Like beauty therapy.
Yeah, like a beauty, and it's tied up with that kind of spa world and beauty therapy.
Or it's a deep sports massage.
Exactly. Which, and deep sport massage is just a brand. It's not really a treatment as such.
Yeah. It just means it's a deeper massage than a beauty,
that's right.
in my view.
Yeah, and I think we're supposed to own the term massage therapist. We're meant to be proud of it, and I am, but I don't think it does us justice, really. I don't think it tells the full story of what we do.
We tend to have people, in my sort of experience, that come to us at the end of everything else.
Yeah.
When they've gone everywhere else, they've tried everything, and it's like in the back of their heads they're thinking, oh, but I just need a massage. Yeah. And then,
So they would have seen... mostly people would have gone, well, I've seen a chiropractor or I've seen an osteopath, and I'm not going to put any of these people down. A lot of them are really good, but sometimes you don't need to go in every week and have your bones cracked. That's not going to always fix you. And I'm lucky enough to work other places where you've got other disciplines, osteos, and they will often refer people to me as a massage therapist. They say, well, actually, you need to see the massage therapist before you come and see me. Or I'm done with you now. Now I'll hand you over to the soft tissue guy. He's gonna sort everything else out. And that's kind of how it works. Yeah. So I see us being I don't see us being an aid to these other people.
No.
I think we're specialists in our own right.
Yeah.
And we get more time with clients than a lot of these other people do.
And chronic pain's on the rise. Pre-pandemic, it was 43% of the UK adult population living with chronic pain, and it's something that the NHS is really struggling to deal with. Whereas we sit in a very unique position because we have the time to unravel perhaps the trauma and the pain.
Well, exactly. They can't. I mean, bless them, the NHS, your GP, they don't have the time to sit with you to find out what's going on. So, a lot of chronic pain is a manifestation of trauma or emotional problems, and we see it all the time. We deal with it day in, day out, so it's very obvious to us where it's coming from. So we try to dig a little bit deeper.
And we're a fusion, really.
A fusion, that's a good word,
Yeah. We love fusion.
Yeah, we do.
Okay, so obviously you're doing a research project as part of your qualification, and in the final year, which is amazing. So just tell us a little bit about what you're doing and why you chose it.
Well, I didn't choose it initially. I chose a completely random topic, and then woke up one night and thought, I'm bored with that, I'm not doing it. And there was something really close to my own heart, was PTSD. And I thought I'd like to know more about it, and I started reading Body Keeps the Score. I mean, it just kind of resonated with me, and I thought, and I knew that I see lots of clients like this, particularly fibromyalgia sufferers and other people with generalised sort of chronic pain issues, and it's very clear that these things stem from
a traumatic
experience. So I wanted to know more about that. It also helped me because I've had some issues of my own in the past. So it was very important to me, and studying it has helped me connect more closely with a lot of the clients that I see.
I think I would say, since you started 17 months ago, that you've kind of gone more from the perhaps scientific rehab, and obviously keeping that, but also understanding the biopsychosocial model.
Massively, and even in people you wouldn't expect. I mean, you'll get athletes come in, and you think, oh yeah, well, no, my IT band's really tight, I need that done. You get them on the couch, and they might say something to you like, you know, I had COVID 12 months ago, and I've got long COVID. I think I don't know what's going on with me. I can't, you know, I'm stressed. And so they come in, you know, because they're training for a marathon. But their training program's all up the spout because they can't, because something else has happened. So then we can move across from the kind of like the more physio rehab stuff, and then pick up on everything else that's going on.
It's interesting. It's like the body knows what to do, the mind's just got to get out of its way. But the mind is often the thing that 100% gets in the way.
And actually, particularly with athletes, there's a lot of psychology with athletes. You know,
it's a whole industry. Sports psychology.
You're right. I mean, the number of marathon runners, you're hand holding them all the way through their training program because they think that I'm never going to do it. They have this imposter syndrome. I'm not going to make it. You're right. You're going to do it. You know? So there's a lot goes on in the head.
Interesting.
Yeah.
Brilliant. Okay. Well, thanks, Lee.
Okay, you're welcome.